My name is Rajeev Lekhram. I'm a physician assistant here at Montefiore Orthopedic Surgery, and I help to manage patients preoperatively and postoperatively. Surgery is last line in our practice, so we try a different variety of options before we get to knee replacement or hip replacement. Those things can include knee cortisone injections, hip injections, physical therapy, gel injections. In our practice, we commonly see lots of hip arthritis. Hip dysplasia is something we see as well. Other folks who may have another comorbidity or issue like sickle cell anemia may have hip issues as well. So there are a variety of things that can cause one needing a hip replacement. And I am really in charge of the non-operative side. I do a lot of the steroid shots. I counsel a lot of patients on stuff outside of the OR. If you watch any sport, they usually have a knee injury. Knee injuries are very common in sports, whether it be basketball or football. So I guess reading into why my favorite athletes were hurt got me very interested in working in sort of ortho. And as I was in school, I realized, hey, this is something I really enjoy doing as opposed to the other specialties. And it turned out to be a great combination of passion and things that I enjoy doing. Grew up in the Bronx, and when I was a kid, my dad used to always take me to the Montefiore ED. I was quite sick as a kid. And for years, I thought Montefiore was the only hospital. And as I grew up and I, became more exposed to different entities of, healthcare, I realized that Montefiore was still that place for me. And I always wanted to work here and return here. And it's been an honor to, come back here and work and really be in some places that I remember myself as a kid. I think that's the thing that really keeps me going. My parents are immigrants, and we serve a very heavily immigrant, population. And I see myself and my family in those folks. I always try my best to give them the best care, the best advice, and really try to help them the best I can.